So I learnt CBT almost 20 years ago now, and I have continued to use the skills and strategies on a fairly regular basis. So for example, I might wake up and unpredictably my pain and joint stiffness is extremely bad one day. And it coincides with a day where I've got busy family and work schedules. So I'll take a moment in the morning to listen to what my thought processes are and to challenge that thinking. So often I'll wake up and feel that awful pain and think, oh, there goes my day. I won't be able to do this and I won't be able to do that well, and this is going to stop me doing that. And with applying what I learned through CBT, I can stop those thought processes and think realistically about, okay, it isn't actually going to stop me from doing what I want or need to do. It might be a little bit harder and take me a little bit longer, but I can still do what I want to do. So it stops me in a sense from over catastrophizing. I also then use skills from the CBT treatment to apply pain management strategies like breathing and relaxation. I also find the technique of distraction to be extremely helpful, and an example that always sort of comes to mind when I think of that is a couple of years ago had some very painful orthopaedic surgery because of my arthritis, and I took into hospital a photo of my two children. And when I came out of recovery and I was in excruciating pain, I used the photo of my kids to focus on them and to think about all the joy and the happiness associated with them. And when the pain was at its worst, I would use that as a distraction tool to take my mind off my current pain, but also to then help me think forward that, I'd had this very painful surgery for a reason, and it was so that I could be more mobile and do more with my kids. So certainly distraction is a very good technique that I've learnt as well. When I use CBT, I think now after 20 years, I just do it automatically. And I think at times I don't even realise that I'm using those strategies. But for me, it's about stopping and really analysing my thought processes and not letting them get carried away. So I guess in a sense being analytical about what is it that's madly racing through my mind because I've got these elevated pain levels, and challenging the genuineness or the reality of where my head is my thinking is going with that pain. It's something that the skills from that I use even with parenting my children at times, that they've got such wide-ranging application. It's an excellent technique. So before I learnt to use CBT, I think I struggled through managing my pain, relying very heavily on pain medication, and I guess mentally and emotionally really probably feeling quite oppressed with living with that pain. I think that by learning CBT, it gave me another strategy in my arsenal for managing my pain, and it stopped me from being so heavily reliant just on pain medication. And it taught me that I had the power within my psychological capacity to manage my pain, not just with drugs.